In this latest study, we've looked at how frequently chest x-rays are used in English general practices and how much variation there is between different general practices in how they utilize chest x-ray. A lot of the things were as you would expect, really. So practices that had a higher proportion of older patients, patients aged over 65, they undertook more chest x-rays. Patients who had higher proportions of smokers as well did more chest x-rays, as you might imagine. But some other things that you might think, for example, socioeconomic deprivation, we couldn't really find a clear signal there either way. And I think the biggest thing for me really is just how modest the effects of all these characteristics seem to be on that variation. My intuition would be that a lot of this comes down to cultural factors within practices. So really differences in how we perceive chest x-rays to be useful, and just differences between GPs ourselves and how often we request this because of our own preferences and patterns of practice. It's plausible that undertaking more chest x-rays in patients who have symptoms, I would say very plausible, that would lead to improved outcomes. So by improved outcomes, I mean earlier stage of diagnosis and survival. But I think we still need to do that extra. We need to make that extra link in terms of the evidence between the behavior of chest x-ray rates and the lung cancer outcomes. And that's something we'd like to look at in a future study.